So hello everyone, welcome back to my channel. I'm Prajakta Dandime. So in today's video we are going to learn about history taking. History taking is an art, so it is very important to take history for the proper diagnosis. So history taking is divided into 8 parts. I have divided it in 8 parts, okay? So first is biodata of the patient, then the history, proper history. So it includes some other parts of the history. So the history, then examination also include the general examination and also systemic examination, then summary of the case, then provisional diagnosis, then differential diagnosis and relevant investigation. So these are all the parts of our case paper or history. Okay, so first is biodata of the patient. So it includes 8 points. You can add more points also, like socioeconomic status or marital status. You can also add it here, but these 8 are very important. So first is name, age, sex or gender of that patient, religion, occupation, address, date of admission and date of examination. So name is important because you should identify your patient. Okay, so name is important. Age is important because some diseases are very specific to age, like some diseases are seen in only neonates or infants and some diseases are seen in old age. So it is also important to mention age. Sex is also important because if your patient is female, then you have to ask him about menstrual history. So it is also important. Religion is also important because some diseases are related to religious things like diet and personal hygiene things and everything. Okay, then occupation is also important because there are various diseases which are occupational diseases, like diseases of respiratory system, okay, that pneumoconiosis and silicosis, asbestosis, then COPD. So these all are occupational diseases. Then address is also important to find out the endemic diseases of that area. Then date of admission is also important, that we can calculate or we can evaluate the treatment is progressive or not. Okay, and date of examination is also important for the same reason. Then the main part, the history part. So the history part constitute chief complaints, HOPI means history of presenting illness, then past history, family history, personal history, treatment history, menstrual history. So it varies according to subject, like in psychiatry patient, so you have to use the psychiatry history ka alag section. Then in obstetric or gynecology patient, you have to write its obstetric history at first and elaborate it very properly, or menstrual history should be elaborated very properly in female patient. So it varies according to the subject or the problem of that patient. So chief complaints, so chief complaints should be taken in chronological order. So what is chronological order? Chronological order means the the patient having number of complaints, but you should ask him which complaint occur first or which is the main problem for which he is admitted in your hospital. Okay, so that is chronological order. You should mention it in chronological orders. Okay, then each complaint should be written properly with the onset. Okay, then what is HOPI? HOPI is history of presenting illness, means why the patient, what is the presenting illness of your patient. So in HOPI you should elaborate each chief complaint properly. You have to elaborate the individual chief complaint in logical manner. Okay, so how to expand the each chief complaint? So you should ask the mode of onset, like acute, subacute, insidious. Then you should ask progression of the disease, that progressive disease is progressive or static. Or you should ask the duration of that disease. So duration means from since how long that disease is present. Then you should ask him the aggravating factor, then also relieving factor. So okay, so you should explain each chief complaint according to these 5 points in HOPI. And also you should mention the like types of fever. If the chief complaint is fever, then you should ask him range of fever, then type of fever like intermittent, continuous, or remittent. Or you should ask him like fever is associated with chills or rigors. Then also diurnal variation is present or not, or fever is with sweating, or associated symptoms like headache is there or not. You should ask these chief complaints in very detail, and you should mention all it in chief HOPI. So chief complaints should be in the language of patient. Okay, what is the language of patient? Like, I mean to say that you should not write their epilepsy. Instead of epilepsy, you should use the word convulsion. Okay, or you instead of dyspnea, you should use the word difficulty in breathing. It means the language of patient. Okay, I mean, okay. Then what is past history? So past history should be asked by keeping the main problem or main presenting illness of the patient. Don't ask irrelevant questions. Okay, so past history, it should include like mainly tuberculosis, diabetes, asthma, hypertension, or any systemic diseases, or any operations in past, or any similar admission for the similar complaints. Okay, so family history is also important in like inherited diseases which transmit from family to family, generation to generation. And also it is important in communicable diseases because family have the close contact, so it might come through family members, so you should ask here. And also any diseases or like hypertension, diabetes, then tuberculosis, you should ask here also for each family member. Family history is mainly for the first degree relatives. Okay, then in personal history, so personal history contain marital status of that patient, then level of education, occupation, income of the patient, then dietary habits, addictions, lifestyle. This all should be included into personal history. Then treatment history. Treatment history is like any medications are going on, like if the patient having BP, then that medicine should be mentioned here, or any treatment has taken in other hospital and that is continuing today also, then you should mention it. Then menstrual history is also very important for the female patients, you should mention it. Then come to examination part. So examination part is also divided into two parts, general and systemic. So in general, first we should write the level of consciousness of the patient, that it means whether the patient is alert, oriented, and cooperative, or like he is answering your questions properly, or he is just not interested to answer any question, or looking here and there, not alert. So you should mention here. Then also write apparent age. Apparent age means like here you have taken the age of the patient. So if you feel that age is not proper or not corroborative, so you should write here apparent age. Like in diseases like Down syndrome, thalassemia, and pituitary dwarf, patient look younger than actual. Or in diseases like progeria, precocious puberty, or chronic exposure to sunlight, patient looks older than actual. Okay, so you should mention it. Then build is also important. Like build should be written in the form like skeletal framework, or average build, dwarf build, or tall stature. Okay, then you should also mention weight and height to calculate BMI. So BMI is kg per meter square, means weight divided by height square. So with BMI you can come to know about the nutrition of the patient. Then these points are also important. Okay, so the trick for to remember this is pickle, PICCLE, pallor, icterus, then clubbing, cyanosis, lymphadenopathy, and edema. So this is trick you should remember. Then you should also take skin, like skin is hyperpigmented or hypopigmented, any scars or any rashes are present. Then you should write about hairs, like alopecia is present or not. Skull examination you should do. Then nails also important, like in anemia, you see deformity in nail structure. Neck veins are also important. Okay, then these are the vitals. So temperature, pulse, BP, and respiratory rate. We will see everything in detail in further upcoming videos. Like you can comment down for any point you want to learn more, like how to calculate pulse or what are the points to calculate pulse. Like, you know, 3-finger method for pulse, then what are the uses of each finger, then how to calculate the volume, how we come to know that rhythm of the pulse. We will discuss everything in detail in further videos. Okay, then systemic examination. So mainly we consider these 4 systems: GIT, respiratory system, then cardiovascular system, and central nervous system. Then summary of the case is also important. Like, mainly sometime the examiner asks you the summary of your case, so here you should mention it in 2 paragraphs. So first paragraph should include introduction of the patient, and second should include clinical examination and complaint of the patient. Okay, in briefly. Then provisional diagnosis is also important. Most probable diagnosis considering the history and clinical examination means provisional diagnosis. Okay, and differential diagnosis is consider other possibilities in this scenario. Okay, and relevant investigation is also mentioned at the end of that case. So by doing this investigation we can confirm that diagnosis, so it is important for the confirmation. So these all points are very important in history taking, so note these points and also do your clinical postings. History taking is very important, and every doctor should be pro in history taking because it is the crucial step to identify the diagnosis or to confirm your diagnosis. So yes, that's it for today. Thank you.